Alright team, we have a patient with staphylococcal enteritis, ophthalmia and herpetic gingivostomatitis. What could be the diagnosis here?
Well, given those symptoms, it could be a number of things. Maybe a severe bacterial infection or a viral infection.
I'm thinking it could be a case of multiple concurrent infections. We need to run some tests to pinpoint the exact cause.
There's a chance it could also be a rare genetic disorder affecting multiple systems.
No. It's hypophosphatasia, I'm certain of it. And the treatment is clear, we must perform a hemicorporectomy.
But doctor, that's an extremely risky procedure. Are you sure that's the right course of action?
Oh, Hawks. Maybe we should consider other options before going with such an invasive surgery.
I agree we should exhaust all other possibilities first. Hemicorporectomy is a last resort.
Damn it, I'm the lead here and I say we go with the hemicorporectomy. It's risky, but it's our best shot at saving the patient's life.
No, suit up. We're going in.
Tracy, I need to perform a hemicorporectomy on my patient with hypophosphatasia.
Hawks, are you sure about this? It's a highly risky procedure.
I've been a surgeon for over 20 years, Tracy. I know what I'm doing.
But Hawks, we need to consider all options before going through with something so extreme.
Don't question my expertise, Tracy. This is the best course of action for my patient.
Hawks needs to know the truth about the procedure. Hemicorporectomy was not the solution for hypophosphatasia. I have to be honest with him, even if it's difficult. He deserves to know.
What in the world were you three thinking? You nearly killed our patient with your incompetence. Wrong hemicorporectomy and wrong diagnosis.
I swear we did everything by the book, Hawks. We followed the protocol. I don't understand.
Maybe there was a misunderstanding in the lab results. But we did our best. We would never intentionally harm a patient.
I still think the diagnosis was correct. It must have been a rare case that we couldn't have foreseen.
My foot! My foot! My foot!
You call yourselves diagnostic doctors. You're a disgrace to this hospital. I should have trusted my instincts and not relied on you bunch of morons.
Hawks, please, let's talk about this. We can figure out what went wrong.
Yeah, maybe there was a mix-up in the patient's records. We can still rectify this.
I'm sure we can make it right, Hawks. Just give us a chance.
I shudder to think of what you would do if Jesus Christ was your patient. Don't come near the next patient unless you all get your act together and start using your brains for once. I can't believe I still haven't figured out what's wrong with the patient in room 203.
Maybe you should try checking the blood work again, or perhaps consider a different diagnosis altogether.
I've already done that, Johnson. It's not as simple as it seems.
Come on, Hawks. You're usually the fastest at solving these medical mysteries. What's the holdup this time?
I just need a little more time to think it through, okay?
All right, take your time, but don't be surprised if I figure it out before you do.
Shock suddenly sits up straight, a look of realization crossing his face. Eureka. I know exactly what's wrong. Thanks for the suggestions, Johnson. I've got to go take care of this. See you later.
Well, I'll be damned. That Hawks never fails to surprise me.
I need everyone's attention. Hypophosphatasia was a misdiagnosis. We're dealing with alveolar capillary dysplasia here.
Wait, what? Are you serious, Hawks? You can't just barge in here without the right equipment and change the diagnosis like that.
This is completely unprofessional, Hawks. We have protocols for a reason. You can't just play doctor and make such a drastic call.
I have to agree with Kelly. This is not how we operate. We need to follow proper procedures when it comes to diagnosing patients.
I understand your concerns, but trust me on this one. I've seen the signs and we need to act fast. Let's get to work on treating alveolar capillary dysplasia. Tracy, I finally found the right diagnosis for the patient.
That's great news, Hawks. I'm glad we got to the bottom of it.
If you had just listened to me in the first place, this whole ordeal could have been avoided.
Hawks, the wrong diagnosis almost cost the patient their life. You can't just blame me for this.
But I knew something wasn't right from the beginning. You should have trusted my instincts.
Your instincts led us down the wrong path, Hawks. You should have listened to me and the rest of the team.
I can't believe you're turning this around on me, Tracy. I knew I was right all along.